When Gastonia native Mallory Guffey was just 8, a fall from her bicycle sent her to OrthoCarolina. The experience changed the course of her life.
I was on family vacation at Kiowa Island in South Carolina, and me and my family were out riding bikes, just went for a long bike ride, and I just ran over a bump and was going just a little bit too fast and fell off of it and hit my knee. And ever since then, whenever I would run or swim, my knee would just always give me trouble, and it was just really irritating and always painful. So we decided to go get it checked out. My pediatrician referred me to OrthoCarolina, and since we had tried one in Charlotte, we were like, why not try one in Gastonia? So we made an appointment with Dr. Maitra, and we're very pleased with everything he did for us.
I met her probably about 12 years ago when her mother brought her in to see me as a patient. She was 8 years old at the time, in 3rd grade, and she had problems with her knee. She had a lot of swelling, she had a lot of mechanical symptoms of clicking, catching, and popping. It was painful for her, so it really limited her activities and daily life. I'd recommended surgery for her, even though she was 8 years old, and we performed a knee arthroscopy. She recovered from that surgery with a little bit of physical therapy, went back to her sports and activities, and really has had no further problems with the knee since then.
I don't think I was really worried until we actually scheduled the appointment, and then I was just like, Mom, I don't want to do this. Like, this is really scary. I don't want to have someone cut my knee open. Like, what if something goes wrong? And they just assured me that to have the surgery, it would be the most beneficial thing, because that's what was going to make me better, and that's what was going to allow me to run around on the playground with my friends and enjoy swim practice and soccer practice.
Years later, the paths of doctor and patient would cross again and lead Mallory toward her future.
My mom had to go to him for, her knees were hurting one day, and I would always want to go with her to see Dr. Maitra and stuff. And then when I was in college and my mom went back old times, Dr. Maitra always made a point to, how's Mallory? How's her knee? How's she doing? What is she doing in life right now? How's school? And always just checked up on me to make sure I was doing well.
Recently was informed that Mallory was now interested in a career in healthcare and medicine. And so this location was a perfect fit for her to give her some daily experience with patient care and orthopedics.
A rising junior at Clemson and budding medical student, Mallory shadowed Dr. Maitra in the summer of 2013.
Being in and out of doctor's offices my whole life, I would just like to pay that favor back for all the doctors that have helped me so much, and I just want to help others and get them well. She
was very shy when she got here. She didn't want to be obtrusive, she didn't want to get in the way, but as a mentor, that's something that we have to work on so that she can get the true experience of what it means to take care of patients. So slowly but surely, she's become more thoughtful, and she asks questions very freely. She's very interested in all types of musculoskeletal conditions, and I think she's enjoyed her time here. Patients really respond positively to her. They don't feel that they're in a training situation. They're happy to have Mallory shadow and spend time with them and learning about the patient, learning about their condition, and have been very positive for her.
After shadowing Dr. Maitra, I'm actually very interested in orthopedics, and I've grown to love it a lot more. And every time I leave, I'm just like, does it have to be over? And I always am ready for the next time to shadow Dr. Maitra and to learn more.
OrthoCarolina, I think, has a long history of having the resources, willingness, and the skill and competency to mentor people who have an interest and willingness to learn more about medicine and orthopedics.
What Mallory has learned from her mentor has been invaluable.
Going through an actual process and seeing exactly how a doctor, what he does with his day and how he treats his patients shows a lot to someone who wants to pursue medicine. Being in the 3rd grade and having knee surgery, all those big words don't make any sense to you at all. And now that I'm older and I know more things about the body and anatomy, and that has really helped me to understand, like, when people are like, oh, why'd you have knee surgery? You can explain it a whole lot better.
She's very thoughtful. She's not arrogant at all, and she's very smart, and she's committed to a field in healthcare. So I'll be interested to follow her future career to see where it takes her, But certainly I think with her interest and her commitment, I think OrthoCarolina may at some point have a position for her in some capacity.
To work at OrthoCarolina one day, that would be such a wonderful opportunity that would be such a blessing.